Assalamualaikum warahmatullahi wabarakatuh. We are from Group 1 of Biomedical Science. Today we are going to present about dyslipidemia. Okay, dyslipidemia is a disorder of lipoprotein metabolism, including lipoprotein overproduction or deficiency. Dyslipidemia comes under consideration in many situations, including diabetes, which is a common cause of dyslipidemia. Dyslipidemia can be classified into two classifications, which is primary dyslipidemia and secondary dyslipidemia.
Next, we're going to talk about what is the main cause of dyslipidemia. There's two types of dyslipidemia, which is the primary dyslipidemia and the secondary dyslipidemia. The primary dyslipidemia is more involved to genetic defect, especially in children. The overproduction and defective clearance of the cholesterol in triglycerides and the LDL cholesterol is the result of mutation of a single or multiple genes. The primary disorder are the common dyslipidemia cause to the children, although it may not affect in the most cases of adult dyslipidemia. The next, we're going to talk about secondary dyslipidemia. The secondary dyslipidemia is most common in adults because of their lifestyle. So this secondary dyslipidemia is more related to how they adapt to their lifestyle. So the sedentary lifestyle is the most essential cause of this secondary cause. So the lifestyle includes excessive dietary intake of cholesterol, trans fats, and saturated fats. Trans fats are the fatty acids that are either polyunsaturated or monounsaturated, in which there are added hydrogen atoms. Trans fats are usually used in a lot of processed food. Other secondary causes could be over excessive of alcohol use, diabetes mellitus type 2, hypothyroidism, chronic kidney disease, other cholestatic liver disease, and primary biliary cirrhosis. Drugs like thiazides, retinoids, estrogens, and glucocorticoid, and among others. Cigarette smoking, obesity, single or multiple genetic mutation that results in either overproductive or defective clearance of triglyceride and LDL cholesterol, or in underproduction or excessive clearance of HDL. All of these causes of the secondary could cause high levels of triglyceride, high levels of high level of LDL, or it may cause a small and dense LDL, which this LDL is unfunctionable, and also it can cause a very low level of HDL. So because of these secondary causes could trigger secondary dyslipidemia.
Now we're gonna take a look at the pathophysiology of dyslipidemia. Dyslipidemia is due to metabolic syndrome, increased flux of free fatty acid, raised TG values, high density lipoprotein HDL, cholesterol values, increased small dense LDL values, rise apolipoprotein B values, low HDL cholesterol, and hypertriglyceridemia. The dyslipidemia in metabolic syndrome patient may be caused by combination of overproductive VLDL, ApoB100 decreased catabolism of ApoB containing particles, and increased catabolism of HDL ApoA1 particles. Inability to incorporate the free fatty acid to TG by the adipose tissue resulted in reduced fatty acid trapping and consequent retention by the adipose tissue. Adipose cytokines are increased in obesity, and at least under experiment setting possibly can induce obesity-related insulin resistance or diabetes. Increased flux of free fatty acids from the periphery to the liver in the insulin-resistant state stimulate hepatic TG synthesis, which in return promotes the assembly and secretion of TG containing VLDL, and as well as ApoB production in the liver. In the insulin physicians state the LDL levels are usually within normal limits or only mildly raised. However, the LDL particles is often of abnormal composition, causing small, dense LDL is hypertriglyceridemia.
Symptoms and signs of dyslipidemia. Usually, dyslipidemia causes no symptoms, but it also can lead to symptomatic vascular disease, including coronary artery disease, stroke, and peripheral arterial disease. High levels of TG can cause acute pancreatitis. High levels of LDL can cause arcus cornea and tendinous xanthomas. In familial hypercholesterolemia patient, it can lead to planar or tuberous xanthomas. In severe hypertriglyceridemia, it can lead to lipemia retinalis, while in extremely high lipid levels can cause paresthesiasis, dyspnea, and confusion. Now let's move on to prognosis. Dyslipidemia is the main risk factor of cardiovascular disease. From the prevalence of dyslipidemia in Malaysia, 28% of it consists of a patient above 40 years old, while 55% of it are from the patient who have cardiovascular disease. Specific lipid abnormalities implication consists of elevated LDL-C, low HDL-C levels, elevated TG levels, elevated non-HDL-C levels, atherogenic dyslipidemia, and elevated lipoprotein A levels.
Now I proceed with the diagnosis for the dyslipidemia. Firstly, serum lipid profile is a panel of blood tests that serve as an initial broad medical screening tool for abnormalities in lipid. It's a test for the primary lipid disorder. Routine measurement or lipid profiles include total cholesterol, triglyceride, HDL, and LDL cholesterol. Tests can be done in non-fasting state, but for more accurate and persistent result, it must be done during fasting. The test must be postponed if patient has acute illness, must wait for their recovery. Next is we move on to the test for the secondary lipid disorder. This can measure the liver enzyme, urinary protein, creatinine, or fasting glucose, and lastly, thyroid stimulating hormone. Now I proceed with the diagnosis for the dyslipidemia. Firstly, serum lipid profile is a panel of blood tests that serve as an initial broad medical screening tool for abnormalities in lipid. It's a test for the primary lipid disorder. Routine measurement or lipid profiles include total cholesterol, triglyceride, HDL, and LDL cholesterol. Tests can be done in non-fasting state, but for more accurate and persistent result, it must be done during fasting. The test must be postponed if patient has acute illness, must wait for their recovery. Next is we move on to the test for the secondary lipid disorder. This can measure the liver enzyme, urinary protein, creatinine, or fasting glucose, and lastly, thyroid stimulating hormone. Lastly, treatment of dyslipidemia. Firstly, it involves the lifestyle modifications, including diet, exercise, and avoidance of sedentary behavior. Usually, the best treatment for people is to lose weight if they are overweight, stop smoking if they smoke, because stop smoking can decrease the total amount of saturated fat and cholesterol in their diet. Increase physical activity. An example is walking briefly at least 30 minutes 5 times a week. Next is a drug therapy or lipid lowering drugs. There are different types of lipid lowering drug. Firstly is a group of bile acid inhibitor. The mechanism of action for bile-acid inhibitor is to bind acid in the intestines, causing the acid to be excreted. Example of drug in this group is cholestyramine. We move on. Next is the cholesterol absorption inhibitor. Mechanism of action for this group: decrease cholesterol absorption in the small intestines. Next is a fibric acid derivative. Mechanism of action: increase the breakdown of lipid and speed the removal of VLDL. Example of fibric acid derivative drug is a benzafibrate and ciprofibrate. Next, we move to the niacin. Mechanism of action: slow removal of HDL and lower triglyceride levels. Lastly is a group of drug for treatment of dyslipidemia is statin. Mechanism of action is block the synthesis of cholesterol, increasing the removal of LDL from the bloodstream. Example of statin is atorvastatin and fluvastatin.